Good morning, everyone. And we got a pretty busy press conference today. We're going to have a lot of guests in here today to be talking about some things going on across the state of Missouri. But I want to thank everybody for being here today as we continue to keep a close eye on the COVID-19 data. As you know, Missouri is still, unfortunately, seeing increases in cases and hospitalization. We are in constant communication with the Missouri Hospital Association, infectious disease doctors, and our COVID-19 fusion cell monitoring the data and our statewide healthcare system. As I said last week, we are watching hospital staffing very closely and will continue to do everything we can to support our healthcare workers and ensure adequate resources and capacity. On a more positive note, we continue to receive good news on the vaccine front. Earlier this week, Pfizer announced that its COVID-19 vaccine candidate achieved success in its first interim evaluation from the Phase 3 study. This is very encouraging news, and we are proud that Pfizer in Chesterfield, Missouri, is leading the way on this critical global development. Today, Dr. Christina Smith, head of the Chesterfield site, is here with us again to talk about that vaccine. Dr. Smith?
Good morning, and thank you, Governor Parson. My name is Christine Smith. I was born and raised here in Missouri. I currently live in St. Louis County. I went to school at Mizzou. Proudly have my Tiger Paw pin on today. I am currently the site leader for Pfizer's research and development site in Chesterfield. On behalf of Pfizer and the entire team working out of our Chesterfield facility, it is an honor to be here, an honor to be back here today. And as I stated at this podium in May, to beat this pandemic, it would take science, it would take creativity, it would take the resolute will of passionate researchers around the world, including right here in the state of Missouri. I'm here today to share a progress report, and I am excited to say that the results so far are very encouraging. Pfizer has announced that the vaccine candidate we are developing with our collaborator, BioNTech, was found to be more than 90% effective in preventing COVID-19 in participants having no evidence of prior SARS-CoV-2 infection. This was the first interim efficacy analysis of our Phase 3 study. It was great news, and we are very excited and encouraged by these initial results. We didn't know the data until the analysis was performed by our external, independent data monitoring committee, and we did not know what it would reveal. We still have more work to do, however. The study is continuing until we reach 164 confirmed cases. When we reach this agreed-upon number that we agreed upon with the FDA, we will better understand the potential of our vaccine candidate. In partnership with BioNTech, we began enrolling in the Phase 1 study in April, followed with the initiation of our Phase 3 clinical trial in July, with over 43,000 participants enrolled across the world, and over 39,000 who have received a second dose. The design of this trial has allowed us to move urgently while preserving the highest quality and safety standards. Pfizer would like to thank the large number of people who volunteered for this trial, including many Missourians. This has helped us get this far with such speed. In addition to collecting efficacy information, the next steps include providing the safety data that the FDA has requested for our participants. That is, safety data 60 days after their second injection of the vaccine candidate. Although we have not seen any serious safety concerns, I cannot underscore the importance of knowing more about the safety profile of our candidate. We will know more about these results in the coming weeks before we submit the file for emergency use authorization. And we are preparing the necessary manufacturing data to submit to the FDA to demonstrate the safety and quality of the vaccine product produced. If all those data are sound, the company expects to seek an emergency use approval from the FDA and then could start distributing the vaccine by the end of the year because we, that's Pfizer and BioNTech, have already started to make it. All Missourians should be very proud about the fact that so much of the process development work on this vaccine was performed here in Missouri. Over 200 of our employees at the Pfizer Chesterfield Research and Development Facility have contributed to the development and production of our COVID vaccine candidate. I just want to remind everyone the vaccine candidate that Pfizer and BioNTech are developing is a messenger RNA or an mRNA vaccine. So once that mRNA of the vaccine is inside the body's cells, the cells use the instructions to produce the protein antigens, which are recognized by the immune system of the vaccinated individual, and this generates the immune response to the antigen. The Pfizer Chesterfield site is where the plasmid DNA will be manufactured. This is the template used to subsequently manufacture the mRNA drug substance. I would also like to mention the Chesterfield site will be one of the sites in the Pfizer network providing analytical testing to support the release of the final drug product. By doing so many steps in parallel rather than sequential, we have the potential, subject to continued clinical success and regulatory approval, to supply the vaccine by the end of the year. Our work is very challenging, but we have an incredible number of talented and experienced scientists, engineers, biochemists at Pfizer, in Chesterfield and throughout the globe, whose mission and purpose is to develop novel, new biologic medicines and vaccines. In Chesterfield, Missouri, we're not only Missouri proud, but we're Pfizer proud, and we're committed to quality science, quality development, and quality manufacturing. We operate at the speed of science, and we do not cut corners. We have mobilized our best talent who are working around the clock with experiments and plans executed in parallel to support the manufacturing path for this vaccine. Normally, we would have waited for positive clinical data to do much of this work, but not this time. This time we have been and will continue to work as fast as science will allow. I would like to thank Governor Parson for this opportunity, and I'd like to thank you all for your time today. We are one step closer. Science is winning. Thank you.
Thank you, Dr. Smith. Throughout this year, Missouri has led the way in the distribution of federal allocations, from rapid testing equipment and supplies to the treatment of remdesivir. Missouri has been considered a leader in the area, and this will only continue when a vaccine becomes available. We submitted Missouri's COVID-19 vaccine plan to the CDC last month, and we are fully prepared to take action as soon as a vaccine becomes available. In addition to planning for a vaccine, we must also continue to look at the guidance we're issuing at the state level to make sure our procedures are sustainable for the next several months. We have been working hard with DESE and the Department of Health and Senior Services to find a solution that allows us to continue providing a high-quality education to Missouri students, while still ensuring the safety of students, teachers, and all school staff members. Because transmission within our schools appears to be low, and masks continue to be effective in slowing the spread of the virus, Missouri is modifying its guidance regarding when students and educators should quarantine after being exposed to COVID-19 while in a school setting. Today, we are announcing the appropriately wearing a mask may now prevent individuals from being identified as close contact in K through 12 schools. This new guidance applies if a district or charter school has a mask mandate in place and all individuals are wearing their mask correctly during the time of exposure. As long as they do not begin to show symptoms, those close contacts may continue to attend school in person. If the district does have a mask mandate in place, or if either individual, the person with COVID, or the person exposed was not wearing a mask, that close contact should quarantine and stay home for 14 days as they are doing now. Throughout COVID-19, state leaders have worked with a number of infectious disease experts across Missouri. We are happy to have one of these experts join us today to talk more about the data that led us to this decision, Dr. Rachel Orsland. Dr. Orsland is an associate professor of pediatrics at Washington University and St. Louis Children's Hospital. For many months now, she, along with many other experts, have provided expertise on our K through 12 school reopening and operating guidance, and we appreciate her being here today. Dr. Orsland?
Good morning, and thank you, Governor Parsons, for inviting me to be here today. It has truly been a privilege to work with public health officials, school leaders, the Department of Elementary and Secondary Education, and infectious diseases physicians across the state on the issue of return to school. And through this process, we've really examined the scientific literature and guidance as it relates to children in schools. And we've really learned a number of things about how the novel coronavirus affects children. And particularly, it has been thankfully shown that children most often have a very mild course of infection with the novel coronavirus. We've also learned that young children seem to transmit this infection less often than, let's say, adolescents and adults. And what's really been most surprising is that the school environment has not contributed substantially to the spread of the novel coronavirus in the same way that it does for other respiratory viruses like influenza. And that is probably related to some of the biological properties of the virus and as it relates to children, but also is related to a number of procedures that schools in Missouri have put in place that slow the spread of the virus. These are strategies that we could use in the community, but that have been very successfully implemented in schools. And these include things like screening all students, staff, and faculty members for signs of illness, and having people stay home if they have any signs of illness. Schools are organizing to allow for maximal physical distancing. Schools are using cohorting and avoiding crowding and gathering. Schools are providing lots of opportunity for good hand hygiene and access to alcohol-based hand sanitizers. And probably most importantly, schools have utilized masks, both for students and staff. When masks were originally suggested for the public, it was thought that they really prevented a person who was infectious from spreading the virus to other people. But what we've really learned, and really the CDC has come out with new guidance and information on this really recently, we've learned that masks also protect the wearer from acquiring the virus. And we know that when both parties are wearing the mask, that substantially reduces the risk of infection. These practices have been put in place in schools, and what we have seen is that we have very little evidence of spread of the virus when we have a positive case in the school environment. But what we are seeing is that a large number of students are being quarantined related to this exposure. But as we follow the data, we find that there are very few secondary cases developing in those students. And so at this time, it is reasonable to adapt our approach to take into consideration the mitigation measures that are being used and to allow for those students who have a very low risk of infection to remain in the school environment. There still will be students and staff that need to quarantine. Certainly people who have encounters in a social setting, and particularly unmasked encounters, will still need to quarantine. But when all the appropriate procedures are in place, we can feel safe that students who have an exposure but are masked can remain in the school environment. We have a plan as we move forward to continue to monitor the situation in school. We are working closely with our public health department as well as with the CDC to continue to monitor the situation in schools, and we will adapt our approach as new information emerges. But at this time, we feel like this is an appropriate practice, and we could really all take a lesson from school children and use these strategies that are so effective in reducing transmission, such as avoiding crowds, using physical distancing, and probably most importantly, using face masks. Thank you.
Thank you, Dr. Orsland. Commissioner Van Dieven is also here to talk more about the changes and what that will mean for our students, families, educators across the state. Commissioner?
Good morning. Sorry, hung up on my earring here. Okay, good morning. To echo Governor Parsons' comments earlier, we can't thank Dr. Orsland enough for sharing her expertise with our team at DESE, as well as our school leaders, our school nurses, and local health officials throughout this pandemic. How fortunate we are today to hear from two great Missouri researchers in our state. It's been a great morning so far. As you heard the governor say, the procedures our schools have been following regarding quarantine are not sustainable. As we work to provide in-person learning opportunities for students and our families who need it the most. The large number of students and school staff members required to quarantine has presented a significant strain on educators, school leaders, and Missouri families alike. These large numbers of students and staff members who have to stay home is creating significant unintended consequences. And the data, as you just heard, would support that there are other ways. All decisions, as you are well aware, all decisions that we make are firmly based on protecting the safety and well-being of our students and our staff. So first of all, I want to address our students. Some students are doing quite well in this virtual environment, but others do not. And that's despite our teachers' best efforts. We're seeing our families struggle with significant amounts of stress as they try to keep up in a distance learning model of instruction. In particular, quarantine students may have difficulty interacting with their teachers to get the support they need, as many of those educators are also trying to teach their students still in person in their classrooms at the same time. Now, our teachers have been working tirelessly to meet the needs of all students wherever they are. But quite frankly, it's exhausting and it is not sustainable. We shared during the spring's extended building closures that our students miss out on important social and emotional growth and development with their friends and their teachers at school. And we've had countless families reach out to us, truly concerned about their students' mental health. And we've had our education leaders reach out to us, truly concerned about the well-being of our teachers through this ongoing uncertainty. We also know that when our older students have to stay home from school to quarantine, they're often getting together with their friends in an unstructured environment, and many are not distancing or wearing masks. So having those students at school where distancing and masking are monitored may be among the safest places for them and may help to further reduce overall community spread. In addition, the large number of teachers and school staff members in quarantine has made it impossible for some Missouri schools to continue offering any in-person learning opportunities for a period of time. Our agency has worked with the governor's office to try to get a more substitute teachers into our schools to help with this problem, but we simply cannot meet the demand that the virus has created. We understand that COVID cases are on the rise across the state, and the safety and well-being of our students and staff remains at the forefront of our decision-making. States like Iowa, Nebraska, and Wyoming have implemented a similar quarantine protocol to this, and they have not reported an increase in transmission rates in their schools. We encourage schools and local health officials who choose to follow the new guidance to keep close tabs on positive cases in their schools and alert DESE and DHSS at the first sign there may be a rise in cases. We want to work with state and local health officials to monitor this change in guidance and make any adjustments necessary to keep students and school personnel safe as we move forward. Now, I have not yet met anyone who wants to see our schools closed. If we want to keep them open, it's up to all of us. Wearing a mask, social distancing, and proper hand hygiene in schools, as well as in our personal lives, continues to be important in combating the spread of the virus. Those important preventative measures have not changed, and we're asking all Missourians to please help us in these efforts by using these mitigation strategies so that we can continue doing all that we can to provide high-quality learning opportunities for our Missouri students during this challenging time. Thank you.
Thank you, Margie. In addition to the students and educators, we believe this change will also provide relief for our healthcare professionals across the state. As we continue to evaluate our COVID-19 response efforts, we're hearing more and more that some hospitals are experiencing staffing challenges due to the parents of school-aged children having to stay home with their quarantined students. We hope that these new guidelines will give some important relief for these healthcare workers as well as all workers that are having to stay at home with their kids in quarantine. As Missouri continues to address and respond to COVID-19, another issue that has become increasingly important is liability protection. It has been over 8 months since the first case of COVID-19 was identified in Missouri on March the 7th. Shortly after, I signed an executive order on March the 13th declaring a state of an emergency in response to COVID-19. Since that time, Missouri hospitals and healthcare providers have gone above and beyond to respond, adjust operations, and provide exceptional care to patients. Many other organizations across the state have also been critical to our response efforts, including manufacturers, businesses, schools, and churches, just to name a few. None of these groups should be penalized for their efforts to respond to a declared state of emergency. They must be able to continue operating and serving the public without risk of unnecessary and senseless claims, which is why today I am expanding the call to special session to include new legislation regarding COVID-19 liability. The proposed legislation includes three main provisions regarding liability protection. Liability protection for healthcare workers who provide care as necessary by a declared state of emergency. Products liability protection for any person who designs, manufactures, labels, sells, distributes, or donates products in direct response to a declared state of emergency. Permissive liability protection for exposure claims related to a declared state of emergency. Like I have said many times, COVID-19 is unlike anything we have ever dealt with before. Our healthcare workers, businesses, schools, nonprofit organizations, government, and many others have worked extremely hard to respond and help Missourians as best they can in a rapid changing environment. And they should not have to worry about lawsuits against them for simply doing their jobs. I would like to thank Senator Schatz and Representative Vescovo for their support on this legislation and leading their chambers through this process. Timely passage of this legislation will be very beneficial to many industries and organizations across Missouri. To finish this week, we'll be traveling to Perryville this afternoon for another veterans event as well as a ribbon-cutting ceremony at Ozark Technical College in Springfield. Tomorrow, we will be visiting with Southwest Missouri Association of School Administrators. And I hope everyone has a good weekend, and as always, please continue to be safe, smart, and responsible. I cannot emphasize enough how important it is that we all do our part. That means social distancing, wearing a mask, and washing your hands, and just one of these, not just one of these, but all three. The responsibility to avoid large gathering in crowds, limit interactions to less than 15 minutes. Our actions do make an impact. And for my fellow Missouri citizens, we've been going through this for almost 9 months. In the beginning, we didn't know what was going to happen or where this virus was going to go. Today, thankfully, we know much more about it than what we did. Over the 9-month period of time, dealing with this virus has come all the way to everyday responses to how healthcare workers respond to it, who it affects, and now that we know who are at higher risk than others, it's time we make adjustments for those people. It's also time for all of us to take responsibility. We know in the last 30 days these numbers have increased more than we ever thought they would. That is the hard fact of where this virus is going. When people talk about being a rural-urban issue, you need to take that off the table. This is a Missouri issue. This is about all Missouri citizens. And we have to do our part. Yesterday, as I celebrated Veterans Day with many of my veterans, it reminded me of the mission at hand. And what that mission was when you're a member of the armed forces is that you complete that mission. You successfully win that mission to help people you'll never see, you'll never know, or you'll never meet. We're at that time in this state. The next 4 weeks are critical. We all have to do our part. Politically, I know the mask mandate has been out there for months to do that. But it's not just about a mask mandate, and it's not about politics. It's about social distancing. It's about 15 minutes. It's about every Missouri citizen doing their part to be able to help one another, to the people you'll never see, you'll never meet. The reality of it is we can't keep going at the pace we're going and keep doing the same old things we've been doing. I protected freedom throughout this year. I protected it in my campaign. And the majority of people believed in what I was saying. But I'm here to tell you this to all my Missourians. It is time we got to step up. We got to do our part to protect one another. No government's going to do that for you. You have to take that upon yourself. You have to take that responsibility to help one another. We can't keep expecting the hospitals to meet the demand. It's not about ventilators. It's not about ICU beds. Frankly, it's about having enough staff to be able to handle the situation at hand. That's why this is so important as we move forward, that we all have to take a different action. And I also realize it's virus fatigue out there. As I travel the state, I hear people every day. And I will assure you, including myself, need to do a better job. In the beginning, we washed our hands continuously, every day, time and time again. We kept social distancing. We knew the importance of the 15-minute span. But we've all got a little relaxed on that. And we all have to step up our game to help one another, because it is up to me and you. There was a young man one time, a young teenager that was down in his life extremely, and he said there was 10 two-letter words that turned his life around. And he said, if it is to be, it is up to me. I tell you, if it is to be, it is up to us. We all have to take actions. We got to do our best that we can do. Thanksgiving coming, holidays are coming. I understand that. I understand as much as anybody how important family is. But you got to think through the decisions you're going to make. And you got to do what's best for Missourians. Whether you know them, whether you're close to where they live, this is about all of us doing the right thing. Thanks, everybody, today, and God bless. Kelly?
All right. We'll take a couple of 2 or 3 questions from each speaker. So, Dr. Smith? Any questions for Dr. Smith? Sir?
Yes, Justin Andrews with Channel 4 in St. Louis. You kind of mentioned it. You talked about that the workers there are about 200 workers working on this vaccine. Talk to us about how many hours went into this, and also I want to know your thoughts about a no mask mandate.
I will talk about our scientists. I can't tell you exactly how many hours. It's been 24/7 for the past, months. Individuals come in on weekends. We have shift work sometimes where they come in, work long and hard hours. We have individuals working from home long and hard hours. I've never seen a mobilization and a focus so strong to deliver this vaccine.
And one last question. What's specifically being done? I think a lot of people want to know what's kind of going on behind the scenes. People want to know kind of what's going back there. So explain to many people in layman's terms what's happening behind those closed doors at Pfizer.
Okay, so our site in Chesterfield, Missouri, we're a research and development site. We actually house a group called Pharmaceutical Sciences. And what pharmaceutical scientists do is they develop the processes to manufacture the product, in this case the vaccine. They also design the assays so we can assess the safety, efficacy, and quality of that particular product, in this case the vaccine.
Thank you. What is the hoped outcome for this vaccine for the economy, education, and healthcare?
Well, I think the hope is that today we've taken one step closer to combating this horrific pandemic. We hope to deliver a safe and effective vaccine. We are working with the regulatory agencies to make sure that it is both safe and effective as we move forward.
All right, Dr. Smith will take one more. All right, thank you. Dr. Orsland. All right, Philip.
Does this change only apply to elementary students or also middle and high school?
This applies to K-12 education.
And does it matter what kind of mask are being used, whether it's surgical or cloth?
It can be a community-based face covering.
All right, thank you, Dr. Orsland.
Thank you.
Commissioner Van Dieven.
Hi, Commissioner.
Hi.
Over here.
Great. Hi.
Wanted to ask, this morning we've obviously heard from a handful of you that masks really are important. Obviously now with this new guidance, it sounds like masks are needed. So why isn't there a mask mandate in schools across Missouri?
I think there are a number of schools who have elected to do that, and we're using this policy to encourage that even further. And our local boards are well equipped with our superintendents to make those decisions, and we think this policy supports that.
So are you saying that DESE would support a mask mandate?
In a school, yes, absolutely.
All right, any other questions for Commissioner?
Thank you.
Dr. Williams. All right, Philip.
Hey, Philip. This question is actually from Sebastian at KBIA. He says there are local health departments in the state that either haven't received CARES Act funding or little of it. Is there any plan on providing any funds directly to those health departments? And considering their counties are sending their unspent funds back?
Yeah, we're going through that process right now to see how the redistribution of those funds would look like. And again, very fortunate to have Scott Fitzpatrick and Dan Hogg and the governor leading that effort. I don't know what the specifics of that will be, but the governor has clearly said that we want to spend that money in Missouri for the very real needs we have. And I think if you'll stay tuned, you'll see exactly what that looks like. Thank you.
Dr. Williams, from what I understand, the list of facilities for distribution and storage of the vaccine is due pretty soon from the state. Is that all finalized right now?
It is, and I had said we would announce that last Friday. In conversations with General Perna and others, they've asked us not to give the actual sites for security reasons, so that will not be forthcoming. I think intuitively people at some point will figure that out, and we understand that. They've just asked us not to publicize the actual sites.
And Is the state prepared for storage of this as far as dry ice and ways to keep this vaccine cold?
Yeah, the sites have been picked because they have the freezer capacity to store at 94 degrees below zero. But to your question, as we build out, we would like to distribute it in other places, and dry ice will serve that capacity. So as Dr. Smith and I were talking, in the beginning, it's just so important that as soon as it's available, and General Perna feels this way too, that we get it immediately. But shortly thereafter, we will start looking at distributing it throughout the state.
Doctor, the other morning in committee, Representative Kip Kendrick from Columbia suggested that one of the reasons not all school districts have a mask mandate is because of pushback from the communities that they're in, to the point of death threats being given to school board members and to school administrators. And he suggested that it would go a long way to helping those folks if the state would take that burden off their shoulder and put the mandate out, make the responsibility for the mandate a state responsibility. Why is that not a reasonable thing to do?
Well, you know, as I told the representative, certainly I respect people who have different opinions. I practiced for 30 years, and it's not unusual for colleagues to have different opinions. But at the same time, we still feel strongly that at the local level, we all think masks are incredibly important. There is no disagreement on that. We're in lockstep on that. The question from a public health perspective is what is the best way to have people do that? And that we realize that at certain levels, one style would work, at another level, another process would work. And we think when we talk to our local health departments, and I think when Margie talks to her local superintendents, they have a better feel for what will work best to get us to the goal of not having anybody get COVID, of which one of the components of that is wearing a mask. So the debate comes on what's the best way to get people to do that, and we just think that that varies.
All right, last question, ma'am.
Thank you. I'm over here.
Thank you.
In the latest White House Red Zone report, it also recommends weekly required testing at places like universities. Is this something you've considered or recommended?
Well, I just looked at it this morning. We are doing a remarkable amount of testing. It is just staggering how much more, and I don't remember the number off the top of my head, but it was just staggering how much we're doing in Missouri. And we're trying to be surgical or purposeful about how we do that and where we do that. And we're just adding more and more platforms all the time. Again, the Binax now in our schools, our universities. And so, yes, we always take that guidance under advisement. And as the governor said, you know, we have capacities now that we didn't have back in April. And it's a good thing. The governor's been incredibly purposeful, whether it's PPE or testing, that we needed to get ready to not be in the same position we were last April. And we have. But that hasn't happened by accident. We worked very hard on that. I'll just add, that's, I think, the last question. I just, again, based as a clinician who practiced for 30 years, just can't thank Dr. Smith and Dr. Orsland enough. Dr. Orsland's been on the phone call with the governor and me I know where she's been every Saturday morning for the last 7 months, because she's been on the phone with us. And, you know, upstairs we have statues of heroes, people who've contributed significantly to this country from Missouri. And in my mind, both Dr. Smith and Dr. Orsland probably ought to have statues up there in their teams, and all those people who volunteered for the studies. It is clearly our path to get to a better place with the vaccine. Thank you.
Thank you, Dr. Williams. Governor Parson? Andrew?
Governor, we've just spent the past 40 minutes hearing the importance of wearing masks in schools. Right now you have a special session where lawmakers are on the floor not wearing masks. Is it something that you've considered, you know, requiring in this building while they're on the floor? Because we hear the importance of wearing the masks in schools.
Again, those are separate chambers. The House has their rules, the Senate has their rules, and we've abided by that for years. I think, again, I'm just going to stress to you, from day one, we've said the importance of wearing a mask. That's never changed. It never changed. But the House of Representatives have their set of rules, the Senate have their set of rules, and that's how they abide by that.
Sir?
Governor, you said that obviously there's no statewide mask mandate. The question I have for you, how is that no statewide mask mandate working?
Well, first of all, I wouldn't say there is not one. I mean, the vast majority of the people in this state are under a mandate. across the state of Missouri, whether you're St. Louis, Kansas City, Columbia, Springfield, where the main populations are, a lot of towns, a lot of cities are, a lot of counties are. I mean, so to make the assumption that there's not a mask mandate, there most certainly is in the state of Missouri.
So why not have it statewide then?
I've explained that. I don't know how many times at press conferences. It's up to the local levels to be able to do that. I mean, that's why you have elections. That's the purest form of democracy, is for them to be able to make those decisions, for those school boards to make those decisions for the school. Because if you just start letting one person dictate across the state of Missouri for one particular issue, today is maybe an issue you like, but it may not be someday. And that's why I think it's very important as a role as governor that you have to take a balanced approach. I believe in the people of this state, and I believe the people believe in what we're doing, the approach we're taking in the state of Missouri. I think that was proven just a few days ago.
Sir, we're going to the next reporter. Cameron?
With COVID liability, would the protections cover businesses that still disregard local health ordinances or CDC guidelines?
Say the first part of it again.
Sorry. With the COVID liability, will the protections cover businesses that disregard local health ordinances or CDC guidelines?
Yeah, I think that's going to be a process to work out through the legislature. We're calling out to work out those issues as it moves through the process. But the whole point of it is when people are under an emergency order and they're trying to do what is right to help other Missourians, we don't want them to have to be out there subject to the liability cases that people already are advertising. My understanding, they're already advertising on TV to try to instigate lawsuits. That's the last thing we need right now.
Hi, Governor. This mask measure announced today, as you mentioned, it might help with staffing in hospitals, but it doesn't really seem to affect the caseload that they're facing. Are there other options in place that could help with the caseload if it comes to that?
The caseloads for the hospitals? Yeah. Well, look, I think when we expanded the nursing schools at Missouri Western, at St. Louis Community College, I think those are all long-term things that we're preparing for as today. I believe this virus, we're going to be dealing with it for months. The quick thing that we can do is try to make every available healthcare worker we have in the state to be able to figure out how we can get them boots on the ground. How can we get them back in the healthcare system? Whether that's retired, we've been trying to do that. Maybe it's ways that we think of different ways. If we have students that are in nursing school or different phases, that maybe we could get them to where they could be more active in the hospitals. I mean, the Missouri hospitalization, they've been working hard on trying to meet these demands, all these healthcare workers, all the experts that you heard today. When you sit and listen to what they said today, remember, we're 9 months into this. Pfizer sitting here today having a vaccine in 9 months is an incredible mission in itself. Dr. Orsland in here today trying to make sure that they understand the true effect of the virus, of how we handle the school situations. How do we keep things going and still be able to deal with the virus? But look, the healthcare workers is an issue. It is a main issue that I'm concerned about right now. Again, I'm not so concerned about ventilators. I'm not so concerned about ICU beds. But I don't know that you have the manpower to be able to focus on all of that. If this disease keeps spreading at the rate it is, we've got to find alternative ways. And there's people every day working on that, working hard to try to figure out how can we make sure and meet this demand. Because the reality of it is we might have to meet that.
We've got time for 2 more questions, Governor. Ma'am?
Hi, thank you. What is the plan for the new guidance for the K through 12 masks and the close contacts when kids eat lunch, and since they do have to take off those masks?
Yeah, I mean, DESE will come out with the policy, the details of it. I don't know exact details of that. DESE would be the best. They'll release something on that to tell you exactly how that would play out and what the schools would be. I assume the local schools would have some say in that too, how they're going to implement that. But I think the best thing is get a hold of DESE, and when they promulgate that in Department of Health, we'll be able to release exactly what that is.
All right, Kermit, final question.
I want to make sure I understand this COVID liability session. That this is coming after Thanksgiving, yes?
Probably, yes. It'll start, I would say the technical part of it will start probably tomorrow, if I'm guessing. The Senate maybe would, but I'm not sure all the procedure, but we hope to get it done as soon as possible. If it's not done by Thanksgiving, I think you would see it completed, I would hope, the week after Thanksgiving.
And in terms of the agenda, you talked about product liability, you talked about service liability, but there's been a lot of discussion in this building about employer liability, requiring people to come to work, and does the employer have any liability if those folks get sick?
Yeah.
Was that considered and rejected?
Look, I think this process is in the beginning process. We put out the language that we believe is a good language, that we've seen what's happened in other states and trying to get that information. Some policies, when they first did it early, didn't work so well in other states, so we've tried to really narrow ours down to what we think is most effective. But again, I think the legislature will take their role in that, and we'll see different, you could see some changes in it. The main thing I hope we can do, I hope we can just get it finished in a timely manner. I think that. Thank you very much for having me.